told you that you could greatly reduce the risk of developing 3 of the top 10 leading causes of death simply by going outside and riding your bike? The American College of Sports Medicine and the American Heart Association have irrefutable evidence to suggest the positive effect that regular physical activity has in the prevention of chronic disease. But what is chronic disease exactly? It is a long-lasting condition that can be controlled but not cured and affects the population worldwide. The Centers for Disease Control has described chronic disease as the leading cause of death and disability in the United States. First, I will discuss the effect physical activity has on cardiovascular disease. Next, I will describe the effect that physical activity has on type 2 diabetes. And finally, I will discuss the effect that physical activity has on certain disorders. Since the year 1900, the primary cause of death in the United States has been cardiovascular heart disease. Engaging in regular physical activity was associated with a greater than 50% reduction in risk, regardless of family history. Recommendations from the College of Sports Medicine and the American Heart Association suggest that 150 minutes of moderate intensity activity a week is effective in preventing cardiovascular heart disease. Research also suggests that 75 minutes of vigorous intensity exercise is associated with an even greater reduction than the moderate intensity exercise would. The benefits of physical activity extend to individuals already diagnosed with cardiovascular heart disease as well. This is important because for a long time, a sedentary lifestyle had been recommended for patients with heart disease. The minimum training intensity recommended for individuals suffering with heart disease is around 45% of the heart rate reserve. However, the preventions of physical activity do not stop at cardiovascular heart disease, but extend to include type 2 diabetes as well. Studies suggest that 1 in 3 Americans born in the year 2000 or later will develop type 2 diabetes. That is 33% of the population. A combination of aerobic physical activity and muscle strengthening activities of minimum of 2 days each week have shown to help prevent or delay the onset of type 2 diabetes. 150 minutes of moderate intensity physical activity per week was associated with a lower risk of up to 58% in high-risk populations. Exercise is highly recommended for diabetes management. Engaging in regular physical activity for diabetes has proven to be beneficial in improving glucose homeostasis, insulin insensitivity, and metabolic profile. Physical activity must be regular in order to be continued benefits, or else the effects begin diminishing after 2 weeks and are almost completely gone after 1 month. Similar to the increasing prevalence of type 2 diabetes, breast cancer has become the most commonly diagnosed cancer and the second leading cause of cancer in women. Physical activity has a positive role on primary prevention of breast cancer risk. Women show a 25% reduction in the relative risk of breast cancer compared with their inactive counterparts. It can reduce the risk of both directly and indirectly by regulating sex hormones, insulin, prostaglandins, and even has some effect on the immune system. Current studies even suggest that physical activity presents health benefits to individuals diagnosed with breast cancer. Research indicates that participating in at-home walking-based exercise programs can help manage symptoms and improve physical functioning during radiation therapy. Increased self-reported physical activity was associated with a decreased reoccurrence of cancer and risk of death from cancer. Now I'm sure that we understand how adopting a physically active lifestyle can delay early onset morbidity and mortality. Overall, physical activity alone has proven to be a great tool towards prevention of a number of chronic diseases. Specifically, physical activity has shown to reduce the risk of developing cardiovascular disease, type 2 diabetes, and breast cancer. Remember that these diseases are all part of the top 10 leading causes of death in the United States. So now that you have been informed on the vast number of effects of physical activity, it is up to you to change the statistics.